Most households have a small box somewhere with a few bandages, maybe a thermometer, and some leftover pain relievers. It feels like enough until something actually happens. A deep kitchen cut, a sudden fever late at night, a child who wakes up with a strange rash. In those moments, the difference between guessing and knowing often comes down to preparation. Interestingly, many doctors keep a small medical kit at home. Not a hospital-level setup, not a complicated system, just a carefully chosen set of basic tools and supplies that allow them to handle common situations safely until professional care is available. The items themselves are not secret. Most are simple, affordable, and widely available. The real difference is how doctors think about what belongs in that kit and why. Most people build their home medical kit randomly. A few adhesive bandages, maybe a bottle of antiseptic, sometimes expired medications from years ago. The kit grows over time, but it rarely follows any clear logic. The problem is that emergencies rarely give you time to improvise. When someone is bleeding, you do not want to search the house for gauze. When a fever spikes in the middle of the night, you do not want to guess which medication is still safe to use. And when a minor injury happens during a power outage or bad weather, access to a clinic may not be immediate. Doctors understand this. Their approach to a home medical kit focuses on covering the most common and manageable problems: cuts, burns, fever, infection risk, allergic reactions, and basic monitoring of vital signs. The first category doctors prioritize is wound care. A typical doctor's home kit almost always includes sterile gauze pads, adhesive bandages in multiple sizes, medical tape, and antiseptic solution. These are the basic tools needed to clean and cover cuts, scrapes, and small injuries. Many also keep antiseptic wipes or alcohol pads for quick cleaning when running water is not immediately available. Disposable gloves are another common item. They protect both the person giving aid and the injured person, especially when dealing with blood. Another common item is antibiotic ointment. Small wounds may seem harmless, but infection is often what turns a minor cut into a bigger problem. A simple topical antibiotic can reduce that risk significantly when applied properly after cleaning the wound. Burn care is another area doctors prepare for. In many home kits you will find burn gel or sterile burn dressings. Kitchen accidents happen frequently, and quick cooling and protection of the burn can reduce tissue damage and discomfort. Some doctors also keep non-stick sterile pads, which are especially useful for covering burns without damaging healing skin when the dressing is removed. The next category is fever and pain management. Doctors typically keep a small but organized supply of common over-the-counter medications. These often include acetaminophen and ibuprofen, both widely used for fever and mild to moderate pain. For families with children, doctors usually store pediatric versions as well, along with proper measuring tools to ensure accurate dosing. Thermometers are another essential tool. A reliable digital thermometer allows quick monitoring of fever, which can help determine whether symptoms are improving or worsening over time. Monitoring is something doctors value more than most people realize. They are not just reacting to symptoms, they are tracking changes. That is why many doctors also keep simple diagnostic tools like a blood pressure monitor or a pulse oximeter. These devices measure blood pressure and blood oxygen levels, providing useful information during illness. They are not meant to replace professional care, but they help identify when something may be outside the normal range. Another category doctors consider is allergic reactions. Antihistamines are commonly included in home medical kits. They can help reduce symptoms from mild allergic reactions, insect bites, or skin irritation. In households where severe allergies are known, doctors may also store prescribed emergency medication such as an epinephrine autoinjector. But even without severe allergies, basic antihistamines are often considered useful. Cold and flu symptoms are another area doctors prepare for. Saline nasal spray, throat lozenges, and basic decongestants are frequently included. These do not cure illness, but they can make symptoms more manageable while the body recovers. Hydration is also part of the strategy. Some doctors keep oral rehydration solutions or electrolyte packets in their home kit. These are especially helpful during stomach illness or dehydration. Another small but important category is tools. A pair of medical scissors, tweezers, and a small flashlight often appear in doctor-prepared kits. Tweezers are useful for removing splinters or debris from wounds. Medical scissors help cut tape, gauze, or clothing around an injury. Flashlights are useful during power outages or when examining injuries in low light. But the most important insight about a doctor's home medical kit is not the specific items. It is the system behind them. Doctors do not treat their home medical kit as a random container. They keep it organized. Supplies are checked periodically. Expired medications are replaced. And the kit stays in a known, accessible location. This simple organization removes uncertainty when time matters. The goal is not to treat serious illness at home. Doctors know when professional care is necessary. The purpose of the home kit is to stabilize common problems, reduce risk, and buy time until proper medical care is available if needed. That mindset changes everything. Instead of reacting to problems, you prepare for the most likely ones. Instead of guessing what you might need, you build a kit designed around the situations that actually occur in everyday life. For most households, creating a practical home medical kit is not complicated. It simply requires understanding which tools matter and why they are useful, and once the kit is built, maintaining it becomes part of routine household preparedness. If you found this breakdown helpful, consider subscribing to the channel. This content focuses on practical systems and knowledge that make everyday situations easier to handle. And if you want to review a structured guide that explains home medical preparedness and practical treatments in more detail, you can also take a look at the resource linked in the description. It provides additional reference material for those who want to study the topic more closely and build a more complete home medical setup.